They make up the panel on the role of philanthropy in mental health. So we have Barbara Ricci, the Executive Director of Mindful Philanthropy. We have Christian Ward, Social Impact Fellow for Behavioral Health for Center for High Impact Philanthropy at the University of Pennsylvania. And the moderator, our dear Aida Murad, who spoke yesterday. She's passionate, as you know, about uniting philanthropists to strategically support mental health starting in the US. So please welcome three beautiful women.
Hi, everyone. This is Aida Murad, the founder of AM Creatives, and I'm really happy to have Kristen Ward here for the Center for High Impact Philanthropy and Barbara Ricci from Mindful Philanthropy. And we're here to talk about the role of philanthropy in mental health. And the way we met, me and Barbara, was really because I was looking on a systems mapping of mental health and trying to explore what is the role of philanthropy. And everyone rounded me to Barbara, as she will tell you about her new work that is aiming to bring in philanthropists together. And she'll tell you more. But before we go there, let us talk about our why. And I'll start with my why of why I care about mental health. And it's really because I know what it means to be alone and to have lived experiences and not have a support system. So my mission is simple, is to create systems change for people who are experiencing mental health. Barbara, I'd love to hear from you. What is your why?
My why is my brother. He has a diagnosis of schizophrenia, and he's been hospitalized for psychosis 12 times. And it took 5 years to find the right medications that worked for him. I saw him very alone during that time. Our family felt very alone. And he's doing fine now. He gives me permission to talk about him if I feel it would help others. And he lives at home with my mom, and that he cares for her. But it's a very lonely existence when you have a severe mental illness like that.
Kristen, what's your why?
I think so. I also see so much suffering, both in our families, in our communities, in our society. And I also see so much opportunity. And there's such a vast amount of people that experience mental illness and substance use disorders and other related issues. And yet there's such an opportunity to elevate these issues, to make them more accessible, to help people feel less alone so that they can improve and live really meaningful lives within our society.
Thank you. So, Barbara, tell us, what is Mindful Philanthropy?
Mindful Philanthropy is a brand new nonprofit launching later this month. Today is Mental Health Awareness Month. And our mission is to increase philanthropy for high impact initiatives in mental health, addiction, and community well-being. We are a full-time national resource for new and existing donors, and our job is to connect grant makers to knowledge, opportunities, and networks so they have the confidence that they're making a difference. Organizations like Mindful Philanthropy exist in other issue areas like education and disaster response, but there's no one else whose sole focus is mental health, addiction, and community well-being. Right now, we're in one epidemic in the middle of another massive and unchecked epidemic here in the United States. We lost 500,000 Americans between 2015 and 2018 due to alcohol use, drug use, and self-harm. Yet if you were to look at a pie that illustrated where philanthropy gives, you would only see a tiny sliver of the pie goes to mental health. We are crowded out by religion, education, human services, general health, and the arts. So Mindful Philanthropy's vision is to increase the amount of high-impact funding for mental health and addiction commensurate with this great unmet need.
Thank you. And Kristen, tell us about the Center for High Impact Philanthropy.
Sure. We at CHIP provide actionable and evidence-based guidance for individuals who want to ensure that their philanthropic funds make the greatest possible difference in the lives of others. We provide guidance to impact-focused donors in any social impact area so that they can have the most potential for impact with their funding. We do that on our website. everything that we do is publicly available for free. So on our blog, on our website, on our social media, as well as through our guidance documents that we produce and education and select consulting engagements that we provide for donors or philanthropic advising organizations. And we've been so lucky to have worked with Barbara and a team of national experts in this space to produce Health in Mind, which is a philanthropic guide for mental health and addiction. And we're just so lucky to have really approached this issue and are excited to see the opportunities that mindful philanthropy takes to the next level.
So, Barbara, first, congratulations on launching Mindful Philanthropy. You're fulfilling a very important and high need. So tell us about the opportunities that you've identified for donors to come in for.
Sure. And I'm really working off Kristen's framework. She was the lead author for Health in Mind, and she had some different strategies, including focusing on young people, expanding access to the full range of what works, and transforming the landscape. I'll give you some examples. Focusing on young people, we need to make K through 12 mental health education in schools mandatory in this country. Currently, only a handful of states have laws requiring that the schools include mental health education in their health curricula. And yet good mental health is vital when it comes to students finishing high school, finding jobs, and steering clear of criminal justice involvement. In the category of expanding access to the full range of what works, I look at integrated care. In these COVID-19 times, more than ever, people understand that when you talk about health, you can't separate the mind from the body. Yet when you look at healthcare and how it's provided in the United States, how we pay for it, and how doctors are trained, that's not the way the system currently works. When you visit your primary care doctor, they should have a medical practice that can help you with all your health needs. Let's say you're getting your annual physical and you and your doctor realize you need support for anxiety and depression. Your doctor should be able to bring in a behavioral health clinician into the exam room to speak with you. And philanthropy can fund nonprofits that focus on policies such as integrating primary care and mental health care. Another example is telehealth. For years, we've talked about using telemedicine because it's convenient and inexpensive for the patient, especially in psychiatry. COVID-19 has really accelerated the use of telemedicine, and philanthropy can ensure that everyone has equal access to telehealth services, which means providing tablets and data for those who can't afford them. This has become a real issue in New York City, where I live, and in some of the neighborhoods hit hardest by COVID-19. Lastly, in terms of transforming the landscape, we must invest in cutting-edge research to prevent, treat, and cure these illnesses.
So, Barbara, can you tell us a bit more about the K-12 mental health education and how that's not implemented across all states?
Yeah, absolutely. I love this opportunity. In America, we have seen rates of depression and anxiety skyrocket amongst our youth, and that was pre-COVID. The rates of death due to suicide for 10 to 34-year-olds is now second only to unintentional injury, like car accidents. Research shows that mental health education increases help-seeking behavior for students, but it also helps the teachers, administration, and parents. We all need to learn these important skills. In 2016, New York State became the first state to mandate that all schools, public, private, and charter schools, incorporate mental health education into their health curricula. The Mental Health Association of New York State was the primary nonprofit organization that advocated to pass the mental health education in New York schools law. And for New York State schools, this was an unfunded mandate, meaning the schools are being asked to teach it by law, but they don't get state funding to do so. The Mental Health Association in New York State, a nonprofit, set up a mental health resources and training center to support the New York schools. And we have almost 3 million students and about 5,000 schools in New York State. The first year the training center was open, 1,500 educators registered on the website. This shows you that schools are ripe and ready to introduce mental health education into the classroom. Since passage of the New York State law, we've seen a few states, including Virginia and Florida, establish similar laws. But the overwhelming majority of states don't have these laws on the books, and philanthropy can help. A donor could fund Mental Health America to write a national policy report about the need for mandatory K-12 education, and they could engage stakeholders around the country. The Mental Health Resources and Training Center in New York State could be expanded and nationalized. This is a great opportunity to improve the lives of millions of students and their families.
So, Kristen, tell us, we have less than 2 minutes, tell us about how is CHIP partnering today with Mindful Philanthropy?
Well, we're so excited and honored to see the work that we started through Health in Mind activated and inspire the launch of this organization. We're very proud that this framework will inform the Mindful Philanthropy's vision to increase high impact funding in the sector. And we so value the work that they are doing to elevate the importance of mental health and addiction. We look forward to continuing to partner with them and share knowledge and expertise that we've acquired over the past 2 years, as well as we'll continue to develop as we look forward to the expansion of Health in Mind as they connect donors interested in this cause to existing resources and expertise.
So with this knowledge out there, in our final minute, Barbara, can you tell us what can donors do now?
Every donor asks the question, how can I help? And there are 3 ways, and there's something for everyone. At the highest level, you may be an organized foundation interested in a major initiative. We and our network of subject matter experts and experienced behavioral health foundations are eager to support you in your decision-making process. We're invested in your success so you can fund in this area. Second, regardless of the amount you can donate, you can still make a difference. We have a fund set up at Vanguard. We accept donations and then direct them to opportunities such as mental health support for frontline healthcare workers. And of course, you can donate to Mindful Philanthropy so we can continue to find you high impact opportunities, knowledge, and connect you to like-minded donors and foundations.
Beautiful. Thank you, Barbara. Thank you, Kristen, for all your work and for moving the needle forward in bringing philanthropy and philanthropists together to support mental health.
Thank you, Barbara, Kristen, and Aida. That was very insightful. I mean, basically, at the end of the day is that there are so many ways you can help, either through money, donation, but also being aware of the present state of how we are all in. So it's wonderful. We can all be a tool and of service.